Good afternoon and welcome to the fourth and final SRA seminar of the 2020-2021 academic year. I'm delighted to be introducing you to Dr. Freeman, who is an academic director of the University of Northern British Columbia Statistics Canada Research Data Centre and is an active member of AgeWell, Canada's Technology and Aging Network. Shannon Freeman is the co-founder of the Centre for Technology Adoption for Aging in the north of British Columbia in Canada, also known as CTAAN, and a collaborating centre for innovations in technology development and implementation to support older adults in rural and northern communities. And what Shannon and her colleagues are hoping to achieve through CTAAN's interlinked projects is to better support older people to age in place in rural and northern communities by making technologies more available to older adults and to the healthcare system which serves them. Today's seminar presentation by Shannon is going to be focusing on and examining technology options to support the persons living with dementia in rural and northern communities. So Shannon, thank you very much for taking part today, and we look forward to hearing your presentation.
Thanks so much, Hannah. It's such a great pleasure to be here today. Hello, everyone. It's my great pleasure today to present to you about examining technology options to support persons living with dementia in rural and northern communities. I'm presenting to you today from the University of Northern British Columbia, UNBC. The UNBC campus is situated on the traditional territory of the Lheidli T'enneh. I'm also the academic director of the Centre for Technology Adoption for Aging in the North, or what we like to call CTAAN. There's strong potential for technology to support health, active living, and aging in place in rural and northern communities. This includes supporting persons with dementia to be able to age with grace and dignity and to achieve the highest quality of life as they age in the place where they want to be. There are existing, new, emerging, and innovative technologies aiming to support persons with dementia to maintain their health and quality of life. Through our work at CTAAN, we recognize the existing gap in services and supports that older persons need, can benefit from, and deserve, and what is accessible, feasible, and affordable for older persons who live in northern and rural communities. It's my pleasure today to showcase some of these opportunities to leverage technologies and to describe some key considerations when aiming to determine if a technology is right for you or someone you know or care for. CTAAN is an AgeWell National Innovation Hub. AgeWell is Canada's Technology and Aging Network. We're also funded by the Northern Health Authority and by UNBC. At CTAAN, we are currently creating a demo showcase lab and as such have received lots of in-kind support and technology products from different technology companies, including Best Buy and Toketech, which I will talk about in today's presentation. I have no personal or direct commercial relationships with any of these technology companies, and I receive no direct benefits related to today's presentation. The technologies are presented to inspire you about what is available and what is in development, and really I hope to spark thought and discussion. CTAAN does not endorse any of the technologies presented today. When I think of the North and Northern BC, this is the beautiful image that I get in my head. Lots of trees, nature, beautiful sunrise. However, when other people think about Northern BC, this is the image they often see. And if you looked outside my window right now as I'm giving this presentation, this is the picture you would get. Lots of cold snow in winters. When I first came to Northern BC and I heard people talk about the unique nature of the North, I thought they were typically mentioning bears and moose. However, no one told me about how different that nature can be, especially that I may have a bear look in my kitchen window at me one day, and that picture in the bottom middle actually happened to me this past summer. Over the years that I have spent in Prince George, I have learned much about the unique nature of the North, and that it applies not only to animals and nature, it also applies to our aging population in the rural and northern communities. When we look at the landscape of technology development to support older persons who are aging here, there's a huge divide between those who have access and those who don't. And currently, in the northern and rural and remote community context, this gap is even greater. Rural and northern communities face a myriad of challenges unique to geographic, population, and resource accessibility. This gap is between technology development and its implementation and sustained use, especially for older adults in rural and northern areas. I see it like a vast canyon. You can't get through. There's a complete disconnect. Those that do go through have a long way and may exert a lot of time or effort. Every so often a bird could fly over that great divide, or by some great act we could actually get from one side to another. Like a hot air balloon, there could be a man-made initiative that supports someone to fly over, but these things are often resource intensive to make those connections. So that was the real thing that sparked the development and the idea for CTAAN, is bridging this gap. We take a partnered approach with the Northern Health Authority to address this gap. CTAAN is a collaborating center for innovations in technology development and implementation to support older adults in rural and northern communities to be able to gain access to these technologies that are being developed. At CTAAN, our priorities focus on adapting, piloting, and implementing new and existing technology solutions tailored to address the challenges experienced specifically in the rural and northern context. I am very proud to say that I'm the founding academic director of CTAAN, where we aim to really make a difference in the lives of people who are living in the North, including older adults themselves, their caregivers, and the health system that supports them. We build on our founding partnerships between Northern Health, UNBC, and AgeWell, and as such, we are known as one of AgeWell's innovation hubs. We are the first hub in Canada from AgeWell that specifically focuses on the needs and issues facing those who are aging in rural and northern communities. And we're really leading the way in our country, highlighting the needs in this context. In addition to supporting persons to age with dignity and grace, we also aim to develop and implement upstream and targeted approaches for technology to enhance health service delivery and reduce demands on the long-term care and acute care sectors. In this case, we're hoping with better uptake of technology that we can support persons to age well and live longer in the place where they want to be. We aim to build capacity for local technology talent and bring businesses to the region to help make an impact on the northern BC age tech economy. And through all our activities, we aim to establish best practices and approaches for technology and aging in the North. Our activities at CTAAN include research, testing, and validation studies of age tech, where we hope to provide evidence for stakeholders on how to adapt, target, and tailor their technologies to meet the needs of persons in rural and northern context. We aim to set the course for sustainable scaling of age tech and build regional, national, and global partnerships. We hope to increase awareness and outreach on technology and aging and provide training opportunities for the age tech leaders of tomorrow. So in my role as academic director of CTAAN, it is my great pleasure to present to you today. Okay.
Hi, Shannon. Thank you very much for such an interesting presentation. And I'm sure everybody who clicks on your presentation will thoroughly enjoy it. I have 3 questions for you. So my question number 1 to you is, what are the pros and cons of your discipline of work?
Yeah, I think the biggest pro and the thing I really love about my job the most is the ability to collaborate and work on so many different teams on different projects. The field of technology and aging, especially to support people in rural and northern communities, is so diverse. And so it's a really nice part of my job to work on all of these different teams from different perspectives. And, you know, work and life is never boring. I find it super exciting to be at the forefront of new technology development and implementation, and looking at creative ways to figure out how we can adapt and then sustain that implementation of these technologies in the rural and northern context. Because so often these technologies are done and they can be spread out, but then they just don't hold. And so thinking differently about how things can be sustained over time, so that it's not just a research project based, but that the project continues and the use of the technology and the benefits from those technologies remain much longer after the project is done. And I guess the other pro I'd really want to highlight is the ability to make such meaningful connections and meaningful differences in the lives of people who live in the rural communities and in our northern context. And I think it's a real honor as an academic and a research partner on so many of these projects to be able to see that change. You know, so often we do research that you don't see that change is so slow, and yet with community-based research, which a lot of our projects are, you can see those changes and those effects of the research and the differences in real time. So those, I think, are some of the biggest pros of working in the field of technology and aging and working in research to support older adults to age well in our region. I think some of the challenges or the cons, I mean, I don't need to tell you, you're a leader in this field, but just keeping up with the pace of all of the technology and all of the changes and adaptation. And it seems like, you know, sometimes it can be overwhelming. There's new stuff being developed every day and coming out. And so wading through that and keeping up and always being at the front of what's happening can be quite a challenge. The other thing I would say is, you know, building CTAAN and launching this research collaboration center and Age Well Innovation Hub in the middle of COVID has been really challenging. Like, we have had to think so creatively and differently about how we can do things. And I think there's always that need to constantly be flexible and having to always be willing to pivot. Even when you've invested a ton of time in thinking this might work, you know, you need a plan B and a plan C and a plan D, because all of the changes and unpredictability due to COVID have really put a lot of challenges before us that we haven't been able to.
But, you know, Shannon, I was thinking about that in the presentation and over the last few weeks, and, you know, with CTAAN, which is just phenomenal experience and opportunity for yourself as an academic, but also for the northern communities and people living there. But, you know, what best way to start something in the middle of a pandemic? Because at least, you know, to me, if it can work in a pandemic, you know, how is it going to work in a post-pandemic society? You know, and, you know, you just mentioned about having to pivot and everything. You know, there's the working of being agile and thinking out the box and being innovative and creative and maybe pushing the boundaries.
Yeah, I definitely agree with that. I think the one opportunity that has come with COVID is it has accelerated adoption and acceptance of technology for some groups of people. Not all. It has widened the gap, but for some, it has really accelerated that use of technology.
When you say you think it's widened the gap with the digital exclusion, digital divide, is it just, or have you seen, is it just with the older people, or is it younger adults as well?
I think I think in our context here, the lens that we really see is the rural and the northern context, where that digital connectivity, that infrastructure is not there. So for some communities, it accelerated the ability to get digital connectivity, to put up the cell towers, to connect them to the internet. And so that has been amazing. And that's, see that here.
And, Shannon, we've worked together on the Till project, and, that was a fantastic insight into technology use and adoption and the perceptions of technology by adults 70 and over, living in both rural and urban communities in the UK and Canada. And, I just wonder, kind of a similar project such as Till maybe should be run again, 5-6 years down the line, to see, not like a longitudinal, but, kind of like case study, to see how those previous participants have now managed with technology a few years on, and with a pandemic.
Yeah, and Hannah, I think those findings from the Till study still hold true, and maybe even more important and more relevant to a larger number of people today. The need to connect with across generations, across different age cohorts, to help use technology, to learn new technologies, and the idea that technology is building that connection for social engagement, for keeping connected. I think those findings from the Till study, that it's not that people are adverse to technology, but that many don't understand the language that technology is being described and introduced, and the way that the instructions for technology are written. Those findings from Till are definitely very clear, and still relevant during COVID-19, when we see the massive number of people who have connected to Zoom and Skype, and it's a daily occurrence for many people, if you have the technology access.
And it's having those basic skills, isn't it, of, is it the right or the left button on the mouse that you click? Where do I go, or how do I install Skype or Zoom? It is just those simple initial steps that many of us take for granted now, but we forget that a lot of people, old and young, are digitally excluded.
And just in using technology, remembering all of those pieces and what button to press. Like, how many Zoom calls have you been on where they say you forgot to unmute yourself? Like,
we can't see you.
Right? Your video is not on. We're looking at your ceiling. So I think there's also been because we see those challenges with using digital technologies like Zoom and things like that. I mean, I think we all are much more accepting, and it's almost like a norm to have those challenges in a call, for everyone of all ages,
and all abilities as well.
Mm-hmm.
My second question for you, Shannon, is what has been your biggest challenge throughout your research and study?
Yeah, I think the Till study that we did showed a lot of those challenges in the rural and northern context, about actually being able to access technologies. And so there's a lot of myths and stigmas about people not being willing to use technology, or not being interested to try something new, when in fact it is this divide, this difference between those who have access and those who don't. And I think that's one of the biggest challenges to this, not only my research, but the whole field, and that especially includes persons with dementia. There are numerous technologies and opportunities that are being created to be more inclusive of persons with dementia, to be able to use technology and to be able to leverage technology to enhance not only their health, but also their well-being and quality of life. So I think that's some of the big challenges. I think the other one we already mentioned is the challenges of doing community-based research, authentic research that really includes people during times of COVID. And I'm sorry, as a working mom from home, my kids are just on their way out the door to school. So I apologize.
No worry at all.
That guy on the BBC now. So sorry about that. Yeah. So biggest challenges, again, being an academic, doing research, working from home, and balancing all these things, I think is also a real challenge during COVID. And I think the final one, since we've newly launched CTAAN, we are building our networks, we are expanding our relationships with people, and it is hard to get connected to people, especially those who are not necessarily online. Not all technology requires you to be online, but building those relationships with people who are in rural and northern communities without being able to go and see them and meet in person. And I think that's also a real challenge that we experience here right now.
And finally, Shannon, my third question, what improvements would you like to see in your research discipline?
So my first one is I think we need to recognize the importance of being inclusive in research, and authentically including people in rural and northern communities. Often they're not represented they're not represented enough in research. I think it can be really challenging to authentically engage people, including those who have dementia. And one of the biggest barriers we face is navigating the ethics boards here. And I think work needs to be done from an ethics perspective to be able to include people with dementia at all stages of their journey with dementia. So we have some definite work to be done. And I think that is recognized provincially where we are in Canada about the need to reduce some of those barriers to their ability to participate and share in research.
Just for colleagues who are not familiar with the Canadian way of ethics boards or RECs, REBs, could you just give a couple of examples, please?
Yeah, so for the majority of academics, we're governed by a tri-council policy document called the TCPS2, and it has very strict guidelines about how to ethically conduct research that involves human participants in Canada. And that document is interpreted by ethics boards. And sometimes we, especially in the North, we do multi-jurisdictional research, or HANA, when we collaborate with our UK partners, it challenges us to have to navigate multiple ethics boards. And for some, they're very, very restrictive in how they interpret some of these ethical guidelines, which results in exclusion of people from being able to participate in research, how to navigate the fine lines between assent and consent, those kind of rules. So it can be quite challenging here as we navigate that. And I think we have a move to what we call patient-oriented research in Canada, and I know you have a different UK term for it, Hannah, where patients are involved as research partners. And I would broaden the word patients to people, the people that you're doing the research about. You're no longer doing just about them, but you're doing it with them, and they are authentically included as a member of your research team.
Yeah, I mean, we've got a lot of co-creation, co-design, development, participatory design workshops, depending on what discipline you're in. And then from a health discipline, you might hear PPI, which is, initial engagement with prospective target audiences who feed in. So, another term would be research design group workshops. And you can ask them questions, and they, they feed into your study design or research grant.
Yeah, so in that context, I think in the past 5 years in academia, we have made leaps and bounds in that area, and in recognizing the value and the importance of doing research that way. And I think with the rise of the movement of patient-oriented research, it is challenging the way research is done from all points of research, including the ethics process, how things can be done to be more inclusive than exclusive in the research field. And so I have great hope that things will improve with that, and some of those ways of doing research will become more clear from as articulated from the ethics board, that have been informed by people who are living with dementia, that they are raising their voices about how they want to be included in research. And so I'm very optimistic that things will improve there.
Before we finish, is there anything else you would like to add?
I just think opportunities like this to share our research, across countries and to other people is a wonderful opportunity to showcase, what can be and opportunities that can have, and to welcome opportunities for collaboration, and to build more research that's done across jurisdictions, that's not just localized. There are a ton of rural and northern communities in the UK, and I think that there's a lot of similar experiences and shared challenges, but there's also shared opportunity and creative things that have been done, that we have the opportunity to learn a lot from each other. So I really appreciate the opportunity to present today, and I really welcome people to reach out and connect if there's something of interest in today's presentation, or you just want to learn more. I put our website up in our presentation, and feel free to email me and connect with me anytime.
That's great. Thank you so much, Shannon. And I appreciate you getting up at really early to obviously fit around the kids going to school and everything. And what time is it now? Is it like 4 a.m. your time?
No, it's 8 a.m. now. So that was my kids getting out to go to school. So yeah, no. So it's not too bad of a time difference today.
Well, that's great. And thank you very much. And thank you for just letting anybody who views the presentation that they can reach out to you. You also have a Twitter account, so you'll be tagged in that along with the CTAAN Twitter account as well. So once again, thank you very much.
Thanks so much, Hannah, for having me.
You're welcome.